Carbimazole differs from propylthiouracil in that it does not inhibit peripheral conversion of thyroxine to triiodothyronine. The thyroid inhibitor which produces the fastest response is Lugol's iodine. Choose the correct statement about carbimazole. It induces improvement in thyroxic symptoms after 1 to 4 weeks therapy. In the treatment of hyperthyroidism, carbimazole has the following advantage over radioactive iodine. Hypothyroidism, when induced, is reversible. Lugol's iodine is used in hyperthyroidism preoperatively for 10 to 15 days. The aim of iodine therapy before subtotal thyroidectomy in Graves' disease is to reduce the friability and vascularity of the thyroid gland. The uses of sodium or potassium iodide include the following except as antiseptic. The physical half-life of radioactive iodine 131 is 8 days. The most important drawback of radioactive iodine treatment of Graves' disease is subsequent hypothyroidism in many patients. Propranolol is used in hyperthyroidism as short-term symptomatic therapy till effect of carbimazole develops. Radioactive iodine is the treatment of choice for the following category of thyrotoxic patients: elderly patients with ischemic heart disease. Insulin release from pancreatic beta cells is augmented by the following except alpha-adrenergic agonist. Action of insulin does not include the following: facilitation of neoglucogenesis by liver. The major limitation of the thiazolidinediones in the treatment of type 2 diabetes mellitus is low hypoglycemic efficacy in moderate to severe cases. Glucose entry into the cells of the following organ or tissue is highly dependent on the presence of insulin. Adipose tissue. Choose the correct statement about actions of insulin. It favors translocation of glucose transporters from intracellular site to the plasma membrane. It enhances transcription of lipoprotein lipase in vascular endothelium, and it increases production of the enzyme glucokinase. The insulin receptor is a tyrosine protein kinase receptor. The primary route of administration of insulin is subcutaneous. The duration of action of insulin zinc suspension, that is lente insulin, is 20 to 24 hours. The most common adverse reaction to insulin is hypoglycemia. Which of the following is true of counter-regulatory symptoms of insulin hypoglycemia? They generally appear before neuroglucopenic symptoms. Which of the following is a neuroglucopenic symptom of hypoglycemia? Abnormal behavior. There is no alternative to insulin therapy for all type 1 diabetes mellitus patients. In diabetic patients, around the clock tight control of hyperglycemia achieved by multiple daily insulin injections or insulin pumps prevents macrovascular disease more effectively and is associated with higher incidence of hypoglycemic reactions. In patients of diabetes mellitus maintained on insulin therapy, administration of the following drug can vitiate glycemia control: prednisolone. Insulin therapy is required for the following category of type 2 diabetes mellitus patients: patients with ketoacidosis, patients undergoing surgery, and pregnant diabetic. Which of the following measures is not an essential component of the management of moderately severe diabetic ketoacidosis? Sodium bicarbonate.